School is around the corner, and it's time to start thinking about preserving the health of your children as they head back into their classrooms. We are honored to have Dr. Sara El-Sayed with the McLaren Flint Family Medicine Residency Group practice with us. Thank you so much for being here today. We need to glean from your wisdom.
Thank you. I'm very happy to be here today.
So as children are heading back, what is important for parents and guardians to be thinking about right now as the kids go back to school?
So a few things. First is make sure you start working on the kids' sleep early on and don't wait until the last night. Get them in to see their physician for their wellness, child wellness visit, so they can get all of their screenings in. Make sure that they have their sports physical if they're going to participate in any kind of sport. Make sure that you optimize their nutrition, lots of fruits and vegetables, get those kids out to play, get them off their screen, and make sure that you think about their immunizations as you go to see their physician.
So let's talk about immunizations. There's been a lot of back and forth about immunizations, but they are part of that health checklist. So can you expand on that a little bit more? Why is it important?
Yes, absolutely. So the answer to your question is they're extremely important. And I understand where there's a lot of back and forth about this. Parents want to do the best thing for their children. They're asking those questions and they're looking into this information to do the best thing for their children. And that's exactly why those immunizations are indicated, to protect them and to preserve their health. Back to school is the perfect time for all those germs to spread. There is 20 to 30 kids in that classroom. They're all together in a confined space. Germs spread with overcrowded spaces, and it's the perfect time for the immunization. Those vaccines are on the school schedules for a reason. They're there because it's the perfect time, and it's the most vulnerable time of that child to pick up that illness and possibly deteriorate into complications. So just remember, as a parent, that those immunizations are not put on those schedules lightly. They go through a lot of rigorous regulations. They've been administered to millions of children over decades and decades of research. They're supported with evidence. We know that they work. We know that they protect our kids. And if you're looking for the most powerful thing to help your child and protect them, vaccinate your children.
And yeah, and children don't often always wash their hands too, even though I know educators promote that. Sleep patterns. How do you get your kids? It's been summer, they've been, going past their bedtime. What do? How do you get them in a pattern?
Yeah, so if your children have been sleeping very late and waking up later during the summer break, start now. Start at least 2 weeks before your school. If you try to do this the night before, it's not going to work. So first and foremost, fixed bedtimes. So they go to bed at the same time every night. They wake up the same time every morning. Shift it 15 minutes earlier every night. So just keep shifting until you get to their target bedtime at school. And expose them to sunshine the moment they woke up. Early breakfast jump starts your body and helps your body feel more awake. Get them moving, get that activity in, get them tired so they're all nice and tired for bedtime. Get screens out of the bedroom an hour before.
All right, we have 15 seconds left. Getting an appointment, how important is that? Sometimes there's a backlog. It's hard to get in.
If you call our office, we can get you in the same day for acute concerns, same week for a wellness visit.
All right, Dr. Sara El-Sayed, we appreciate the feedback because I know a lot of parents are out there watching going, I got to get going on this matter.
Absolutely.
All right.
Thank you for having me.
Thank you so much.